Welcome to Spectrum Perspectives, real talk with parents, professionals, and autism advocates, with your host, Cindy Gellermini.
Hi, everyone. This is Cindy with another episode of Spectrum Perspectives. And today we have Dr. Usman with us. Hi, doctor. Welcome to the show.
Hi, thank you for having me.
So I did an interview with Honey Renisella, and it was part of the movie Spellers, the Spellers movie, but she also does a conference called Med Maps, and she had mentioned that, and she had also mentioned you. I talked to her, I think, off camera for a while, but that's what sort of led me here to you today. And I know that you're a doctor, but you also have your own personal story with your own children that kind of led you to where you are today. And you can also read it on your website as well. But why don't you tell us a little bit about that journey?
Yeah, when you think about journeys, you think, God, how did I get here to where I am right now? So I am traditionally trained. I grew up people say, where are you from? I say, Indiana. And I went to Indiana University. I did my residency at Cook County Hospital, downtown Chicago, because I really wanted to take care of really sick people. And I had a daughter while I was at County, and my daughter had a lot of asthma and allergy type issues. Mm-hmm. And I couldn't get answers for her health issues in the traditional world. All I got were drugs. And I said, I don't want her to be on drugs for the rest of her life. I really want to try to treat what's underlying that. And my second daughter was born. She had type 1 diabetes. And that's another big one, having to take insulin for your whole life. Mm-hmm. And then my other daughter had multiple chemical sensitivities, very severe, to the point she can't go to school. She can't go anywhere without having severe issues. And my eldest daughter ended up actually passing away from a peanut allergy.
Wow.
And so I worked really hard to try to find answers. And I mean, as a parent, you're just willing to go to the ends of the earth to help your child. And in the process of learning about my children, I started researching issues in copper zinc imbalances in children with autism. And I ended up just attracting a lot of families with kids with autism. And I've been doing this type of work with children on the spectrum, children with special needs since 1997. Been at this for a really long time.
Yeah.
And I guess, some people call it functional medicine, integrative medicine, holistic medicine. And we even call it biomedical medicine. But the group of doctors that take care of children with special needs in the functional world or biomedical world, we're called Medical Academy for Pediatric Special Needs, or Med Maps.
Ah, okay. Got it.
And we started in 2012, and before that it was called DAN, Defeat Autism Now.
Yes. Oh, it's the same organization?
The same people.
Oh, okay.
An organization with a different name, but it's the
Right.
same people who were teaching, and
Right.
And now Honey Renisella is the executive director.
Okay, got it. All right. I didn't realize that.
Because my kids were sick and I was trying to look for answers, and
Right.
this put in my lap.
Right. Yeah, it's so interesting that you also have a child with type 1 diabetes and the chemical sensitivities. I have chemical sensitivities, but not as severe as your daughter. But I can't. That's why I have to hire someone to clean my house, because I can't do the chemicals. I can't do like window cleaner and stuff. I get really nauseous from it, and I can't be around people that are wearing perfume or anything like that. I can always I can pick up on the smell of chemicals in things, that other people I guess don't pick up on, which is odd.
We really wanted to try to get her to go to college. She's very bright. Mm-hmm. And we found a college where, it's pretty outdoorsy and pretty natural, and they use this oils for their cleaning agents,
right,
and stuff like that. So I'm like, okay, maybe you'll be okay there. And she had to come home around Thanksgiving because of dryer sheets.
Ugh.
the fabric softeners,
Wow.
and people using like hairspray and
Oh, yeah.
nail polish. And when it comes to chemical sensitivities, it's parts per trillion.
Wow.
I mentioned my daughter with the peanut allergy. I mean, it's not like you get a lot of peanut and your body just disintegrates. It was literally like she just could smell a peanut and her
Yeah.
immune
Right.
wacko.
Right.
So when I think about like these kids with special needs and these kids with these chronic illnesses, they're sensitive.
Yeah.
They're very, very sensitive. And I
Yes.
think people realize that maybe they don't have like diagnoses of allergies or diagnoses of multiple chemical sensitivities, but they're sensitive.
Yes. Yeah.
Whatever we can do to kind of, clean up, I call it clean up the environment, clean up their diet, clean up their gut, really helps their gut-brain connection.
Mm-hmm. Well, the thing is, people will ask me, oh, when you talk about the autism rates and how much they've gone up, like when my son was born, it was 1 in 10,000. And I've watched it go to 1 in 500, 200, 100, up to 1 in 32, or whatever it is now. They're like, what do you think causes it? And I said, yeah, but let's also look at how many kids do you know that have food allergies, the peanut allergies, that you can't even send a peanut butter sandwich to school anymore because it's, and the diabetes. I know we've got several family members that the kids have diabetes. I said, let's look at all of that. Where is all this coming from?
Yeah,
And that's why I'm on that page with you. It's like, you can't just go to the doctor because they just want, they're just treating the symptoms. What's the root? Where's it coming from?
I don't really blame the doctors because they really don't. That's how I was trained.
Right.
Like you're trained, like you make a diagnosis and then you're trained allopathically to give a drug.
Right.
We're trained.
Right. And that's all they know. Right.
But if you went to something like MedMaps or you started researching this, then you realize there are other things that can be done. And there's some of these cultures for thousands of years have used these types of approaches. We may not have all the studies, but we're getting them.
Mm-hmm.
The only thing is a lot of the studies aren't done in a way that, like a lot of the studies with the pharmaceutical companies, they have a lot of money and they're able to do these like amazing studies.
Mm-hmm.
Our studies on some of the biological agents and the natural agents are, they're smaller studies, so they don't have as much, I guess, power is the term in their studies.
Mm-hmm.
So we can still quote studies on various things that can help. I think just like looking at, okay, what is the trigger? What's the potential cause? What could be initiating all this inflammation and dysregulation? And then just working on that, it can help a lot of people.
So, what do you typically do with a family that comes in with a kid with autism?
Well, again, it's just trying to look at the metabolic reasons of why they have these symptoms. And when you think of autism, it's in the DSM-4. So we say it's a mental illness.
Mm-hmm.
That's how we define it.
Mm-hmm.
However, it's mental symptoms with underlying medical or metabolic or biochemical underpinnings. The only FDA-approved medicine for autism is antipsychotic drugs.
Mm-hmm.
And our kids are not psychotic.
Mm-hmm.
They're not psychotic. So it's kind of sad that that's where it's all lumped. But when I start looking at kids, we see all kinds of things going on with them. And they say, if you've seen one child with autism, you've seen one child with autism, basically.
Mm-hmm.
It's such a spectrum.
Right.
So I can't say I just have this protocol.
Right.
It's really kind of like we were talking.
Well, what would they be looking for when they come to you as
really
a biomedical doctor? Like, what are they looking for help, like with their gut or mental behaviors? Like, what would bring somebody to you?
They're
Okay.
looking for those symptoms, the core symptoms of autism: speech, social behavior, stimming, that excitation, typical behaviors. They're looking to get rid of those symptoms. What I'm looking for is what's causing those symptoms.
Mm-hmm.
So a lot of the symptoms they have are related to what I would say excitation in the brain. So how would people present with excitation in the brain? Anxiety, OCD, repetitive behavior. Some people have seizures. Some people, they just can't focus. They just are looping, constantly perseverating. So there's a lot of excitation. The thought process on excitation in the brain is inflammation triggers excitation. So we take it a step further back, and it's like, well, what's causing the inflammation? And the main things that cause inflammation are infection, allergen, toxin, or a major stressor. We start kind of doing the detective work to figure out, what's going on metabolically. And the metabolic train wreck, we call it, that ensues is our issues with, again, fancy words, mitochondria. Mitochondria make energy, and we'll see this mitochondrial dysfunction in these patients, and they just can't make the energy to run different pathways in their body, or make their neurotransmitters, or break their neurotransmitters. So there's a lot of issues with mitochondria. There's a lot of issues with neurotransmitter genetics. There's a lot of issues with, your adrenals getting fatigued and not being able to manage. So there's a lot of end results of this, whatever triggered that inflammation. And the things that trigger inflammation would be things that you're sensitive to or allergic to. Toxins such as chemicals, metals, or mold toxins, infections. The big one that I see for kids is strep, like in patients with PANDAS. PANDAS is pediatric, autoimmune, neuropsychiatric disorder associated with streptococcus infection. And they manifest that as OCD and anxiety and tics. Chronic viruses like Epstein-Barr virus, Lyme disease, long haul COVID, these are things that can trigger the inflammation. And then major stressors, a major life stressor can trigger inflammation. And, there's certain things that can exacerbate all of that, like your diet and things you're putting in your body.
Right.
Yeah, like with diet in our kids on the spectrum, we want to avoid the most inflammatory foods. And the 3 most inflammatory foods are dairy, gluten, and sugar.
Right.
So kind of a basic approach would be.
I hear that a lot. Everybody says to avoid the gluten and the dairy. And I'll just tell you, my son, Robbie, he had severe autism, but he had digestive issues. When he was a baby, he was severely constipated to the point where I will never forget this. One day, he was screaming and crying when he was trying to poop. And when the stool came out, his rectum came out with it. It turned inside out, and there was blood on the stool. And I had to take my finger and push it back in. I was screaming. He was screaming. I was like, it was awful. And then later he would get diarrhea, as he was older. And then you hear about the digestive, issues that a lot of autistic kids have. I did take him to a GI doc. I tried taking him off the gluten and the dairy, but I didn't see any change. And I mentioned it to her, and she says, don't do it. It's a waste of time.
Yeah, so we usually do a trial. A 3 to 6 month trial off the dairy and gluten. And if we see a change, we kind of go with it. But if we don't, I'm not going to torture a patient to eat those foods.
But I think what I want to know is, now that this is many years later, and I'm learning a lot more now, what happens to the body when they do have the dairy and the gluten? Like, what is that? It's causing inflammation, so that's affecting the brain. Like, what is it doing?
Yeah, so as I mentioned, inflammation triggers excitation in the brain.
Which is, what do you mean by that?
In the chemistry, so when you have inflammation, there's different things that trigger inflammation, like histamine causes inflammation. There's these things called interleukins and cytokines. You've heard that term, cytokine storm, with COVID. It's that these infections trigger the body to make all these inflammatory cells. And when they get into the brain, they trigger enzymes and receptors that stimulate neurotransmitters. And a big one that they stimulate is a receptor called an NMDA receptor. It's a glutamate receptor. So when you think of neurotransmitters, people think, oh, serotonin, dopamine, epinephrine, norepinephrine. But a big one in our patients is glutamate as well. Glutamate receptors, when they're stimulated, they help you remember something. They give you a good memory. So you know how like when you remember something, you kind of get excited about it. Like you walk into a room or you see some clothes and you're like, oh, those are so pretty. You know, like you get really excited and then you remember. So you get this excitation, you remember, and glutamate is supposed to turn into something called GABA. You guys have heard of like Valium or Xanax.
Yep.
Valium or Xanax is a way of taking a drug to stimulate GABA in your brain.
Okay.
GABA to me is your chill pill. So whenever we feel like, oh my God, we're anxious, we're so nervous, and we take Valium, it stimulates GABA. So when you stimulate GABA, you feel calm.
Oh,
You're chilled, you're relaxed, you're not
okay.
you can handle things, you don't get overwhelmed, you're not anxious, you're not nervous, your heart isn't racing, your pupils aren't dilating, you're just, I got this, I can handle it, I'm calm. Well, in autism world, there's too much excitation, too much glutamate, not enough GABA. It happens, like I know you talk a lot about seizures, the same thing. A lot of the seizure meds are based on trying to upregulate GABA.
Oh, okay.
A lot of the seizure natural things for seizures that are trying to downregulate glutamate and upregulate GABA as well. So when you have inflammation, you stimulate glutamate.
Okay.
Stimulate this excitation, you stimulate anxiety, you stimulate your memory, but you can get stuck on a memory and obsess about a memory or have a compulsive behavior about a memory. And I call it a loop. Glutamate,
Right.
if you think about excess glutamate, it's like you're looping around and around. Like somebody said something to you and you just get stuck there. Or you remember something that happened 10 years ago and you're just asking your mom or dad, you know, it's just stuck. Can't get out of it.
Yes.
Out of your head.
Yes.
Converting your glutamate into GABA.
Interesting.
And
yeah,
how do you
because I've heard kids on that loop.
Yeah, you hear they'll ask the same question over and over again.
Oh,
They'll
yeah.
say the same thing, or they'll get stuck on certain things like video games.
Oh, yeah.
Or Legos or trains or whatever.
Whatever they like.
YouTube videos, and they'll watch the same ones over and over and over and over.
Yes.
Over again. So glutamate is supposed to make GABA that can get blocked.
Got it.
And a big thing that can block that is heavy metals like aluminum and lead.
Right.
And the things that can stimulate glutamate is inflammation. So we don't want to inflame the body and stimulate glutamate. And then we want our glutamate to make GABA. So we don't want aluminum and lead in there.
Okay.
Whole thing to kind of work really nicely.
So does that mean we shouldn't use aluminum foil?
Yes.
Right? Yes.
You shouldn't cook in aluminum foil for sure.
Okay.
Now, if you have like a pan and it's not touching your food, then I'm okay with it.
Right.
You know,
Yeah, well, I have a friend that she had an issue with her hair was falling out and stuff, and she went and got tested and they said there was too much mercury in her system and all that. So now she like everything's very clean, but she got on me. She's like, don't use aluminum foil. It's like, okay.
I go through the aluminum thing because aluminum cans, aluminum pans, aluminum foil, aluminum baking powder, aluminum in our salt. It's like the third most ubiquitous element, and it's a lot of things. And now all our food is so packaged. One of my pet peeves is, you know, you'll see a baby eating organic baby food and they're sucking on those like applesauce, but they're in aluminum packages.
Ah, I never thought of that.
Yeah. So aluminum causes a lot of excitation, and my kids who have high aluminum, it inhibits their mitochondrial function. It inhibits their glutamate to GABA. And I have these like visuals in my head. When I think of somebody who has high aluminum, I think of that Energizer bunny, you know, that commercial where that bunny's going back and forth and back and forth and back and forth. And like a kid will come into my office and they're super hyper, they can't sit still, they're super fidgety, they've got eczema and then some like immune issues. I'm like, we need to test them for aluminum.
Yeah, wow.
Mm,
Yeah, because I've posted videos on my channel of Robbie. He used to be so hyper, never sat still ever. And
yeah, those
same thing, and he had the eczema, and he used to get sick he had ear infections all the time. When he was like 6 months old, he got laryngitis and lost his voice. I've never heard of a baby that lost their voice from laryngitis before.
well, my daughter, the one who passed away from the peanut allergy, she had asthma and it started like she was 2 months old. She was
Mhm.
wheezing. And I took her to some of my like mentors because I'm in residency. And they're like, babies don't get asthma. I'm like, hello, she has it.
Yeah, yeah,
And there were like nebulizer treatments and try to like nebulize her because I didn't know what else to do.
right.
And this is before the whole peanut allergy thing came out. And I knew like she was sensitive to peanuts. And I asked the school, could you just, keep her away from peanuts? And they said, no, that wouldn't hurt other kids, like school.
Right. Experience. Yeah.
And now it's so common.
Yes.
Like you mentioned, I mean, there's childhood epidemics of type 1 diabetes, allergies, asthma, cancer. And we have to ask ourselves why. Like we can't
What is going on?
just keep
What is
like, oh,
going
let
on?
me give
Yeah.
my kid an antidepressant and let me give my kid an ADD med. Like, why does my kid have ADD?
Yeah.
We just have to ask those questions. And, the more we start asking the questions, the more answers we can get because we don't have the answers to all of that.
Right.
We have theories.
Right.
And there's no such thing as a genetic epidemic. There is no such thing.
You're right. You're right.
We have the same genetics as our kids. We literally do.
Mhm.
We're okay.
Right. So to say that all this explosion of autism is all genetic kind of doesn't make sense, right? Because let's look at Down syndrome kids.
Mhm.
Are there, 10,000 more um, Down syndrome kids than there used to be? No.
No.
Because that we know is genetic, right? So yeah, no, it's got to be environmental.
Yeah.
Um,
And we know that. I mean, the
Mhm.
question is like what do we do about it?
Mhm.
Yeah.
Right.
And sometimes even when, those like you or me, like we know about all this stuff, but yet how do we avoid it? It's like impossible. It's
Right.
impossible to avoid drinking out of a plastic water bottle, especially like if you're traveling.
Right.
And you ask them for a glass of water, they're going to give it to you in a plastic cup and then they're going to pour it from a plastic water bottle.
Yes. Yes. Or an aluminum can. Yeah, it's really hard when you travel to eat healthy because everything is just
I know like all my friends are like, oh, I have such trouble losing weight. And you even see it like in pictures, like if you see young women now versus young women like in the 1950s and 1960s, when you look at the way people look now versus you could see like we're just like we're holding
we're
on to
bloated.
we're holding on to stuff.
Yeah.
And okay, yeah, let's get rid of the carbs. But really, these things that disrupt our hormonal system are called endocrine disruptors. They're all the chemicals, and they have an effect at parts per trillion. You won't even know it's in stuff.
It's so frustrating because I feel like when I go to the grocery store, you hear, well, you can't eat this because of this, you can't eat that because of that, you can't eat that, oh, well, there's hormones in the meat, and there's in the summertime I like to have corn on the cob, and I'm like, well, nope, that's genetically modified, that's not real corn. That's like I feel like it's everything. I don't know what to eat. I don't even know what to do anymore.
Oh, I totally get that. I totally get that. That's why I feel like you got to do your best, and there's no way to be perfect. Otherwise, you'll just drive yourself nuts.
Yes. Yeah, because even the organic stuff, now I'm seeing videos of even the organic has this and this and this in it. It's like,
yeah. Just do your best to kind of decrease the load, clear
yeah,
air.
at least the obvious stuff like the Cheetos and the
Yeah,
the really artificial junk and the soda and the sugars and all that. Yeah.
air, get a good air filter in your home, get a good water filter, clean water, clean air, as clean as you can with the food. I mean, I try to grow some food.
Yeah.
That even gets a little tricky sometimes, and like buying local and trying to buy organic. I mean,
Right.
and I think then when you get hit with something bad, you've got a little bit of a buffer.
Ugh. Talk about pandas a little bit, because when I go on the autism sites, I see some parents, they put the list of what their child's diagnosis is, right? They've got the apraxia and pandas and da 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 da. So explain that a little bit about what it is. You
Yeah.
mentioned it. You said it's the pediatric.
Oh, yeah. Pediatric autoimmune neuropsychiatric disorder associated with streptococcus.
So you have to get strep to get it?
Correct. And we call it PANS and PANDAS.
Mm-hmm.
So PANS is a broader term, but it's pediatric autoimmune neuropsychiatric syndrome. It's not associated with streptococcus, but it is associated with other infections. So it could be associated with.
So when I get a sore throat and I have strep throat, that's streptococcus, right?
Correct.
So it's not associated with that. So it's not like, oh, your kid had to get strep throat to get this.
Yes. So let me explain it.
Okay.
So yes, PANDAS has to do with having strep.
Okay.
Not always strep throat. You could have strep in your ears. You could have strep in your sinuses. You could have strep in your throat.
Okay.
You can have strep in your lungs, your teeth.
Okay.
So what happens is when you're exposed to chemicals or you're exposed to toxins, or for some reason you didn't develop a great microbiome in your gut, your immune system didn't develop the way it should. And then you get a strep infection. How are you going to present? You and I would present sore throat, fever, headache, nausea. We feel crappy. We go to our doctors, our tonsils are huge red and there's white spots all over them. And our doctor puts rapid strep or a culture and says, you have strep, here's an antibiotic. You take the antibiotic, you feel better.
Right.
Okay. Kids with PANDAS, their immune system is dysregulated. So PANDAS is considered an autoimmune condition. So what does that mean? So kids with PANDAS do not present with a strep infection like you and I. So they get around some kid at school who has strep. They come home and all of a sudden the parents are like, what just happened to my kid? My kid is having severe OCD. They're having severe anxiety. They don't want to leave my site. They went from A student to C student. They can no longer write well. They also are peeing a lot. And now they go to the doctor and the doctor says, okay, let me put you on SSRI or something for OCD. But what really happened is they got a strep infection. They did not manage the strep infection well. Their body produced an antibody to that strep. That antibody went up through their nose and into the brain, triggered a part of the brain called the basal ganglia and made them repetitive and stuck. And it was all because of the strep infection the immune system did not manage. And no sore throat, no fever, no.
Is this something new?
Symptoms. So
have we known about this for a long time, or this is sort of more recent?
Sue Swato at the National Institute of Health, she started talking about it. And so strep isn't the only infection that can trigger this type of autoimmune reaction. We get this with mycoplasma, which is walking pneumonia. We see this with Epstein-Barr virus, cytomegalovirus, herpes virus 6, varicella. We see it with Lyme disease, Bartonella, tick-borne infections. You could have an infection no other symptoms except OCD, anxiety, and tics. So there's criteria for diagnosing it, and it is associated with these particular symptoms that come on. We call it a lightning strike. They just come out of nowhere. You know, we're doing okay, and then all of a sudden, you know, we have these kind of mental symptoms. And so the treatment for PANS and PANDAS is work on the immune system. 70% of the immune system is the gut. Work on the gut. Work on modulating the immune system so we don't overreact. And if we have a chronic infection or an infection that might be triggering it, treat that infection.
Right, with antibiotics, right?
Sometimes, yeah. Most of the time in the traditional kind of world, we would use antibiotics. In my world, we might use herbs to work on chronic infection. If you have an acute infection with strep, yes, we would use an antibiotic.
Okay. Yes, because I know a mom that she just took her son to get it because of the panda. So that's why I was just curious. Yeah.
Yeah.
What if you're pregnant and you get strep? Can that affect the baby?
PANDAS. So PANDAS is pediatric, autoimmune, or psychiatric. So it's a pediatric condition.
But it's not something that can be passed down from in the womb?
So say you are pregnant and you get sick. One of the triggers for having a child with developmental delays is your immune system gets activated when you're pregnant. So viruses or getting sick when you're pregnant or having a fever when you're pregnant is a risk factor for having a child with developmental delays later on.
Yeah, because I used to be, I always had sinus issues, and I would always, I used to get sinus infections, and I'm sure.
So we want our pregnant moms to keep their immune system as healthy and quiet as possible.
Yeah.
And our pregnant moms, you know, we want them on a fair amount of zinc, get their vitamin D levels to normal levels, get their zinc levels to normal levels.
Right.
The gut is in good shape. Make sure they do some kind of a detox before they get pregnant so that they can calm down their immune system that way.
Right.
And try not to get sick.
Yeah.
Healthy during your pregnancy. That's sometimes, you know, but those other things do help, you know, the vitamin C, the zinc, the D, they do help.
Yeah, but sometimes it happens, you know.
Yeah, I know from firsthand experience. But if you can keep your immune system strong, and like I said, 70% of the immune system is in your gut, meaning your lymph nodes and your lymphatics. 70% of that is in your gut. And so
Yeah.
a healthy
Explain that, because I don't get that.
Okay. So where are your immune cells sitting? The immune cells that fight things, you're like immunoglobulins. So a lot of them in your spleen, but they're stored in your lymph nodes. That's why when you get sick, your lymph nodes get swollen because they're working.
Right.
So when you think about your lymph system, most of it is in your gut.
I thought it was up here.
Yeah, there's some there. That's where you can feel it.
Right.
But most of it's in here. So it's called the GALT, or the gut associated lymphatic tissue. And most of our lymphatic tissue is in our gut. We just found lymphatic tissue in our brain. We never knew that it existed.
Really?
Just in the last few years. So when we get the infections and things like that, they kind of go through the lymphatics and they get released through the body, through the lymphatics, and you know, in through the liver and out.
So when they talk about the gut-brain connection, what are they talking about exactly? So if you have if your gut is healthy, that infects your immune system, and then that's sort of what you're talking about. It kind of shoots up to the brain.
One way. So if, say, your gut isn't healthy, the cells that hold your gut together, the gut cells are enterocytes, they become deep.
Okay.
Separate. And then things enter your body that shouldn't enter your body, and it creates inflammation. Anything that enters through that leakiness is gluten.
Okay.
Olives. And so leakiness in the gut can lead to inflammation, and then excitation and OCD and anxiety, gut brain. The other mechanism is there's a nerve that goes from your brain to your gut. It's called the wanderer, or the vagus.
The vagus, yeah.
And the vagus nerve goes to your gut and helps with what we say rest and digest. And so that's part of your parasympathetic nervous system, your rest and digest, the vagus nerve. And that sends signals from your brain to your gut and from your gut back to your brain through the vagus nerve, the way that the gut and the brain connect. There's also neurotransmitters, these brain chemicals. And when we think of neurotransmitters, we always think, oh, you know, all our neurotransmitters are made in our brain. But most of our neurotransmitters are made in our gut, and they're made by gut bacteria. So if we have an imbalance of gut bacteria, say we're eating too much sugar, or we're feeding yeast and we're not feeding our lactobacillus that's making GABA, or we're not feeding the right bacteria that's making serotonin, or we're feeding too much bacteria that's making too much dopamine, then again, we're going to have OCD, we're going to have anxiety, we're going to have depression. We take a probiotic, and you know what they call those? They call them psychobiotics.
Really?
Psychological system.
Huh.
Probiotics have psychological effects. So if we take a Lactobacillus rhamnosus GG, it stimulates GABA receptors in the brain and helps us to calm down. So those are different ways that the gut and the brain interact.
So probiotics can help OCD. Interesting.
Yeah, it is very interesting. The probiotic is stimulating signals that stimulate GABA receptors.
Okay. GABA's the good one. The GABA's the one that calms you down. So
that brain connection, I mean, it's related to our microbiome, and our microbiome in our gut is our bacteria levels. We don't want to have too much bad bacteria. We want to have a good amount of the good bacteria. Sometimes if we have too much bad bacteria, we call that dysbiosis. Another word that a lot of people have, or a condition that a lot of people have when they have too much bacteria in their gut, is called SIBO, small intestinal bacterial overgrowth.
okay.
And in that condition, our good bacteria overgrows and produces gas, methane, hydrogen gas, and sulfur gas. And the gases create inflammation, and also some of the gases trigger abnormal neurotransmission in the brain. Our kids with SIBO sometimes act extremely aggressive.
Okay.
And it's really because they have an overgrowth of bacteria in the gut. And when we treat the bacteria in their gut, their behavior gets better.
Okay. Yeah, because I just read the book Underestimated yesterday, and he talked about how he took his son for a transplant. A fecal transplant, right? Then that was supposed to clean up, I guess, the bacteria in his gut, I think.
I think that's a simplistic way of looking at it, but what a fecal transplant is supposed to do is it's supposed to balance the bacteria.
Okay.
So that you get the right balance of the good stuff, and hopefully the bad stuff then can't grow. But there are certain bacteria in the gut. And again, we look at this in our kids and our patients. We look at stool tests. We look at a urine test called an organic acid test. And we can see metabolites of certain bacteria. So I'll give you an example of a bacteria that we don't like to see in the gut is Clostridia. You guys have probably heard about C. diff.
Yes.
Right?
Yes. So not that I know what it is, I've just heard of it.
A is Clostridia and diff is difficile.
Okay.
So what happens is you take an antibiotic, and what happens? You kill your good bacteria, and some of this bad bacteria, like Clostridia, grows. And sometimes a yeast grow or candida grows once you take an antibiotic.
Right.
So if you have an overgrowth of Clostridia tends to affect dopamine. So what it does is it prevents us from breaking down dopamine. So what happens if we have too much dopamine? We act psychotic.
Yeah.
Literally.
Okay. So
I
was going to say what causes the good bacteria and the bad bacteria, but you answered that. It's antibiotics can do that.
Yeah, so then where do we get antibiotics? I mean, obviously, if you have an infection, you take an antibiotic,
Yeah.
you disrupt your microbiome.
Right.
But where else do we get antibiotics? And a lot of our kids got antibiotics, like the moms got it at the delivery.
Yeah.
So that disrupted their microbiome. Some of our moms had C-sections. So that
Oh,
disrupted
yeah.
the microbiome. Some of our moms had a lot of antibiotics when they were a kid. And then so they didn't give their kid the good bacteria.
Ah,
And a lot of moms are unable to breastfeed and they bottle feed, and that disrupts the microbiome.
hmm.
And a lot of our animals are fed antibiotics.
Antibiotics. Yeah.
So our microbiomes are just a little bit, they're really affected. And what we see in, not just children with autism, but patients with even like later on in life, dementia, Parkinson's, they're finding that it's really the underpinnings, the start of all of that is a disrupted microbiome.
And then like eating gluten and dairy, does that affect it as well? Or this is more just because of antibiotics?
Yeah. So again, you kind of like the scenario would be, okay, well, I got early antibiotics. I had a bunch of ear infections. Then,
That's my kids.
yeah, and then the immune system gets affected because of this, right? And then we end up with the leakiness in the gut. Then gluten enters the system, dairy enters the system. We end up with food sensitivities and more inflammation. All we see is the inflammation. It's presenting as eczema, asthma, allergies, later on in life, anxiety, OCD. It's all inflammation.
Arthritis.
Yeah.
Mhm.
Itis, so bronchitis, dermatitis, arthritis, encephalitis.
Hmm.
And it started off because we disrupted our microbiome.
How do we
And then
fix that?
things enter the body that shouldn't enter. It's not just dairy and gluten that enters that shouldn't enter, but then like, say you get exposed to heavy metal and you don't have a good intestinal barrier, you're not going to poop it out.
Right.
You get absorbed.
Right.
And so, how do we fix it all?
Right.
That's
Yeah.
a $1 million question.
Yeah.
So again, we try to do our due diligence, cleaning up the environmental factors, cleaning up dietary factors, looking at the gut microbiome with stool testing and organic acid testing, and rebalancing the microbiome with probiotics, prebiotics, postbiotics. And sometimes we do have to do some antimicrobials, like some bug killing. I'm kind of known for my like biofilm protocols and things like that to clean up the gut. So it's kind of an area that I'm really interested in.
Mm-hmm.
And then, supporting some of these metabolic pathways that are disrupted, like methylation and mitochondria, supporting adrenals, the hormone system, and then detox, get the junk out so the body can really heal.
Right. Yeah. A friend of mine just told me about a spray that detoxes you. I was like, well, I'm not going to just spray something in my body until I figure out what it is.
Yeah, and then there's claims, right? So like now in the beginning, we're all a little hesitant, or we need some evidence that certain things do help.
Mhm.
Yeah, so if somebody just says, oh, here, this is a spray and it's going to detox you, I need to know more about what that is
Right.
and how it works. Are there
Right.
some steps behind it?
Right.
We try to do, we try to have some evidence behind what we try to do.
Right.
Evidence-based medicine.
Let's talk about, I had it on my list, we talked about the GABA, the CFD. What is that?
CFD stands for cerebral folate deficiency. Think about, okay, folic acid. Why do we take folic acid when we're pregnant?
I don't know.
Okay, so think about folate and think about anything midline. So folate helps develop the neural tube, your whole like spine and your central nervous system. It's really important for the development. So what they found is if you didn't have folate, some patients had like neural tube defects. They had midline defects. So spina bifida, hypospadias, cleft palate, cleft
My
lip,
son had hypospadias.
tongue tie,
Yes. Okay. Interesting.
causing midline,
Hmm.
the whole, anything midline, think of folate.
Okay.
So we take folic acid so that those kinds of things don't happen in utero. Now, there is a condition where you take folate and you can't get it into your brain.
Okay.
That leads to a deficit of folate in the brain, or the cerebral folate deficiency. You need folate not just to develop your neural tube, but you need folate in the brain to make your neurotransmitters. And you need folate in your brain to make something called glutathione, which helps you to detox. So if you can't get folate into the brain, you might have issues with speech, processing, language, attention, focus, detox, things like that.
Hmm.
So there is this doctor named Dr. Quadros who studied patients with cerebral folate deficiency. They did spinal taps and they found that if you check their body, they had enough folate, but if you check their brain, they didn't. They didn't get it in there. And he found that a lot of those patients had antibodies to the receptor, the folate receptor, that allowed folate to get into the spinal fluid and into the brain. So we can
So the
measure,
antibodies were killing it off and not allowing it.
antibodies were blocking the receptor. So it's
Right.
like something in your parking spot and you can't get into that parking spot.
Right. Right.
So there's two kinds of antibodies that block the receptor. There's blocking antibodies and binding antibodies.
Okay.
People with dairy sensitivities and issues with dairy tend to make more of these antibodies.
Hmm.
Might be some cross reaction, like you react to the dairy and then you make antibodies to your folate receptor.
Okay.
The fancy word is molecular mimicry. We don't know all the details, but we know that there's an association between dairy and these antibodies.
Hmm.
So some people make folate receptor antibodies and they can't get folate into the brain. And if we did a spinal tap on patients, we would see that they have something called cerebral folate deficiency. We don't do spinal taps on these patients, but we can check for these antibodies. Now, if you can't get folate into your brain, you are more prone to having problems with speech. Your kid, it's also associated with having seizures.
Right.
So there is a subset of patients who may have a seizure disorder, but it's really cerebral folate deficiency.
Huh.
So if you treat the cerebral folate deficiency, it might help with their seizures. So
Yeah,
we check.
because Honey told me about that. She said that you had recommended that she get that tested for the folate, and it came back positive that he has the folate deficiency, and so she stopped giving him dairy, and now he hasn't had a seizure in 13 years.
Yeah, so it wasn't just the dairy for patients with cerebral folate deficiency. We do have them. So again, I can't do a spinal tap, so I don't know exactly if they have a cerebral folate deficiency. We can do these, that's called FRAT testing, folate receptor antibody tests. So if they have these blocking or binding antibodies, we kind of surmise that they might have a cerebral folate deficiency. And the treatment for that is a dairy-free diet. But in addition to that, we want to give them a form of folate that can get into the brain.
Oh, okay.
And we give them a form of folate called folinic acid.
Okay.
Just regular folic acid.
Mm-hmm.
And there's a prescription version of that called leucovorin. And in the studies on cerebral folate deficiency, they gave like 1 to 2 milligrams per kilogram. It's just a high dose of leucovorin or folinic acid.
Okay. Okay. Yeah, because I was going to ask, how do you treat it? So you don't do a spinal tap, but how do you test for it? You just do like a blood test, or?
Yeah, so we do the blood test for the folate receptor antibodies.
Oh, okay. And it can come up in that.
It's called a FRAT.
Oh, okay. Okay.
And if they have high levels of blocking or binding antibodies, then again, we want them dairy-free. And then we would do a trial of leucovorin. And sometimes, again, when we give them the leucovorin, it helps them with their language.
Wow.
And so help them with their
Yeah, it's, all of this information is like mind blowing. And this is not something that I would ever take my son to the pediatrician and they're going to tell me all these things. It's just not going to happen. I wish I met you 20 years ago.
Yeah. So again, like, the doctors who've been doing this type of work, we've been doing it since the 90s. And there's some older pioneers, even like Dr. Baker. He started this kind of biomedical interventions. He's like he's our, the father of biomed. And he's in his like 80s now, and he's been doing it like 60 years.
Yeah.
We keep progressing, we keep learning more and more and more, and adding to our toolbox and helping more patients, but it is considered alternative or complementary or holistic, like traditional doctors aren't trained. And that's why, if there's doctors out there, clinicians out there, that want to learn more, coming and learning and doing the research, reading the studies is really important.
Well, that's what MedMaps does, right? They can come to a conference and they can learn these things. Yeah. All right. So you also mentioned something else. You also have are those supplements behind you on the shelf? Do you have
Those are mine.
Okay.
Yeah. So I work at a clinic called True Health Medical Center. It's in Naperville, Illinois. And I've been here since 2003. And associated with my clinic is a compounding pharmacy, because my patients and my kids are so sensitive. Compounding pharmacies make things clean. So there's no excipients and no dyes or coloring or artificial stuff in the medicines. Like if we made clean ibuprofen, for instance, or clean anything nice. And then I developed some supplements for my patient population that I found helpful. And then I put them together in products. So I have one for mitochondria called Mito Rescue. I have one for mast cell activation called Allermast. I have one for biofilms called Mucosolve. So I have one for apraxia-ish type issues. I can't claim that they do anything, right? So these kinds of issues called motor planning issues. So, and I tell people we don't really treat autism. We just treat the underlying medical issues that people have. Right. And when we treat their underlying medical issues, then they feel better.
Right. And that's really there. And there's so many, compounding things really that, so you have to treat all the different things. So do you do telehealth or no? Somebody would have to be in Illinois to go see you?
I have a license in Illinois, California, and in Florida. So we do kind of, in good medical practice, we do want to see our patients.
Right. If somebody does, if they're in Illinois or they want to fly out there to go see you, what's your contact information?
They can just go to the internet and look up True Health Medical Center. And they'll find me, Dr. Usman Singh, S-I-N-G-H is the last name. The website, there's a new patient kind of form that people can fill out and get information. And MedMaps, there's a whole list of doctors who I've trained and that we've trained over the years. So we're trying to create a community of
Right. Yeah. And MedMaps is for anybody in the medical field, like, nurses and,
nurse practitioners, PAs, chiropractors, dietitians who are looking to kind of help in these kinds of ways.
Okay, Doctor, thank you so much for being here. I learned a lot from you today. We could probably learn a whole lot more, but my mind is.
Oh yeah, it's a little overwhelming. I usually tell people, just take it in pieces. If you try to put it all together all at once, it gets a little overwhelming. But
yes.
Little baby steps.
Okay. All right. Thank you so much.
All right. Thank you.
Okay. Bye-bye. That's it for today's episode. I hope you enjoyed listening and it helped you gain a new perspective. To learn more about our children's book series, Robbie's World and His Spectrum of Adventures, or to learn more about what we do at Robbie's World Foundation, simply visit our website at robbiesworldbook.com. autismspectrumdisorders.com.
Thank you for joining us today. Be sure to join us again on our next episode of Spectrum Perspectives.